When I was 40, the last thing on my mind was a heart attack. Why should it? I was enjoying my family, my life. Then it took me by surprise. Heart disease is the second largest killer in Canada. It takes 50,000 of us a year. And my acute care team made sure I wasn't one of them. Cardiac rehab can really help you get back on your feet. It certainly helped me. It's not gonna lie, it's been a few years and I've stumbled a little bit. But through exercise, proper nutrition, through proper mindset and medications, you can get your life back and extend that previous expiry date. So that's why we're here today. I want to introduce you to my friend Myrna, the pharmacist. She knows all about this and more. Hi, Myrna.
Hi, Cyril. It's so nice to hear that you're doing so well following your heart attack. Taking your medications properly is an important aspect of cardiac rehabilitation.
After my heart attack, why do we take so many medications?
So once you have a heart attack, your chances of having another heart attack are much higher than your first chance. You end up taking this multi-medication regimen in order to treat your current heart attack, prevent future heart attacks, and reduce the risk of dying following a heart attack. So that's why you end up taking so many medications. In fact, this regimen has been studied extensively over a period of years to show that it is beneficial. So no matter how you remember to take your medications or how you keep yourself on track, it's always important to know what you're taking and why you're taking them. So let's go over what a heart attack is.
A heart attack is what we call a myocardial infarction. It happens when there is severe narrowing or blockage of the arteries on the heart. This happens when there is plaque buildup, which is cholesterol deposits on the walls of the arteries on the heart. And if those arteries get blocked or severely narrowed, it can result in damage to the muscles of the heart. The longer the time the arteries are blocked, the bigger the heart attack. I would like to think of heart attacks as a spectrum. In one end, people can have significant or severe narrowing in one of the arteries, and they may have a small heart attack. On the other end of the spectrum, people actually can have a total occlusion or a blockage of an artery, typically because of a plaque rupture, which can result in clot formation and blocking the artery completely. Both of those cases can result in damage or injury to the muscles of the heart, where people can have chest pain because of dead and dying tissue. The typical symptoms of a heart attack is chest pain or pressure or heaviness, typically felt in the center of the chest, and is usually hard to localize, that people experience in a rapid onset. Sometimes this is associated with shortness of breath, sweating, and feeling generally unwell. If you experience these symptoms, you may be having a heart attack. You should call 911 to go to the hospital. Never drive yourself to the hospital or ask someone else to drive you. Typically, after a heart attack, you will be on 5 different medications. 2 of them are to prevent clot formations in the artery of the heart and to keep the stents open if you receive the stent. And there are other ones that actually keeps the arteries healthy, prevent scarring, and promote healing of the heart. And one of the very important medications that you will typically be discharged with is a cholesterol pill that keeps the plaque stable and prevent plaque rupture and forming of new plaques, which can result in future heart attacks and even strokes. There are medications that will also prescribe to you to reduce the frequency and recurrence of chest pain after a heart attack. Collectively, these medications will promote healing and prevent further heart attacks. Taking those medications are an important part in the rehabilitation journey, where you will feel better and hopefully live longer.
What's the difference between generic and name brand medications?
So different companies will manufacture the same generic drug. However, the active ingredient must stay the same. They in fact do studies that show the brand name drug will have the same clinical effect on your body compared to the generic forms of the same drug.
They have different packaging, but they work the same.
That's exactly right.
I'm supposed to take a baby aspirin every day. I'm not a child. Why do I have to take baby medicine?
Yeah, so aspirin is actually the brand name for a drug called acetylsalicylic acid, or we say ASA for short. And the term baby just refers to the small dosage required for it to be an antiplatelet medication. It's by no means a children's form of a medication. But let's talk about aspirin because it's one of the first drugs we need to prescribe following a heart attack, an antiplatelet medication. So in our blood, there's multiple different components. One of the main components are platelets. So essentially what platelets do is if you have a cut or damage to your arteries, your blood will send platelets to that area and clot it so that we don't bleed out, which is a useful function. However, in coronary artery disease, what we found is that you get an excess amount of platelet aggregation or clotting in your arteries. And as you remember from what a heart attack is, if you have a clot that becomes a blockage in your arteries, that's what can cause a heart attack, right? Because your heart is not getting enough oxygen that it needs to get because of the blockage. So we take antiplatelet medications to stop the excessive clotting in our heart.
Does it stop the platelets or does it slow them down or?
So what it does, if you have a current clot, it will stop it from getting worse, and it will also stop any future clots from forming. And if you do have a future clot, it'll limit how bad that future clot is. And it will reduce your risk of having a future heart attack, it will reduce your risk of having a stroke, and it will reduce your risk of actually dying from heart attack or stroke. If you've had a stent put in or for any other reasons deemed by your cardiologist, you might be on more than one antiplatelet medication. So you could be on aspirin plus clopidogrel, ticagrelor, or prasugrel.
How long are we on these medications and what are some of the side effects?
So usually for an antiplatelet medication, baby aspirin, you'll be on it for life. There are some special circumstances where you don't need to be on it for life, and that's determined by your cardiologist. There are several side effects that you need to take note of. The more common ones and less serious are minor bleeding, stomach upset, and bruising. So if before you've never bruised easily, you can expect to probably bruise easily after taking antiplatelet medications. And if you take 2 antiplatelet medications, your risks are even higher than that. The serious side effects include serious bleeding, and that's a bleed either in your GI tract or having a brain bleed. And another side effect that could happen that's not as serious but is also less common is shortness of breath. Now, the signs of bleeding are also really important to know. So having a bleed either in your GI tract can cause you to have black tarry stools, coughing up fresh blood, or even what looks like coffee grounds in your vomit can also be a sign of having an internal bleed. And if you have the sudden onset of a really bad headache, that could be a sign of a brain bleed. So those are the most important ones to remember. And if you are taking antiplatelet medication, especially if it's more than one, remember not to take any other anti-inflammatories. So over-the-counter medications that are anti-inflammatories include Advil or ibuprofen, or naproxen or Aleve. Taking an antiplatelet with an anti-inflammatory can severely increase your risk of bleeding. So if you have pain or if you have a fever and you want to take something, Tylenol is safer to take that. It's also extremely important to know that you won't be on 2 antiplatelet medications forever. Usually after a year, being on 2 antiplatelets gets reassessed by your cardiologist. So make sure you do have that follow-up and it doesn't get missed. It's also important that you don't stop taking your antiplatelet abruptly, whether it be aspirin or one of the other 3 or the combination of the 2, because if you stop taking your antiplatelet, you can get a clot in your arteries or in your stent, and that's actually more detrimental as an outcome compared to having a bleed.
I'm also on a medication called statin. What's that all about?
So statins are a group of medications that we use to prevent plaque formation in the arteries. Essentially what statins do is they reduce your bad cholesterol and they increase your good cholesterol. So you've probably heard of the terminology LDL for bad cholesterol and HDL for your good cholesterol. What statins also do is they slow down the progression of coronary artery disease. Once you have a heart attack, you have coronary artery disease. So it's important to take your statin medications. Now, some people might say, I don't have high cholesterol. Why am I taking a cholesterol medication? Studies have shown that even in patients who don't have high cholesterol, but they've had a heart attack, being on a statin medication actually reduces their risk of having another heart attack, having another stroke, or dying from a heart attack and stroke. The two most commonly prescribed statins following a heart attack are rosuvastatin or Crestor and atorvastatin or Lipitor. Grapefruit juice should not be taken with atorvastatin, simvastatin, or lovastatin. If you love your grapefruit juice, you can safely take rosuvastatin. And if that's hard to remember, any other type of juice is fine, including citrus juices.
How long do I have to take these medications for?
So usually statin medications are for life, so prepare to be friends with them. And there's some important things to know about the timing of the medications as well. The newer statins, as we call them, rosuvastatin and atorvastatin, you can take any time of day, as long as it's around the same time, either in the morning or at night, it's fine. The older statins, like simvastatin or pravastatin, traditionally they've been taken either at bedtime or with dinner. So if you've been on a statin and you continue to have higher cholesterol, your doctor might prescribe other medications like ezetrol or fenofibrate to lower your cholesterol. These medications are beneficial for lowering your total cholesterol, but they don't have that protective effect on your heart like a statin does. So don't replace any other cholesterol medication for your statin. Your statin is the most important one.
So I had high blood pressure. What are some of the high blood pressure medications that I would have to take?
So there are two blood pressure medication classes that we use following a heart attack. They have really long names, but we abbreviate them to ACE inhibitors or ARBs. And there's lots of different ACE inhibitors and ARBs on the market. As you can see, there are different ACE inhibitors. However, ramipril and perindopril are the most commonly prescribed after heart attack. Because ACE inhibitors were studied more in clinical trials in heart attack and heart failure patients, they tend to be prescribed first. But ARBs have also been shown to be equally effective to lower your blood pressure. So essentially what these blood pressure medications do is they relax your blood vessels, thus allowing for your blood pressure to decrease. And they have many benefits. ACE inhibitors and ARBs can not only lower your blood pressure, but they'll reduce your risk of having another heart attack. They'll reduce your risk of stroke. They'll reduce your risk of dying from heart attack and stroke. They also protect your kidneys by slowing the progression of kidney failure. And they also help with slowing the progression of heart failure and relieving symptoms of heart failure as well. So even if you don't have high blood pressure, but you have had a heart attack, it's really important to know to continue taking your blood pressure medications, because studies have shown that ACE inhibitors or ARBs actually have a protective effect on your kidneys and your heart.
So what are some of the side effects I could be having?
So some of the side effects include feeling lightheadedness or dizzy. So you can imagine if you're reducing your blood pressure, you might experience some lightheadedness or dizziness. About 1 in 10 people might actually get a dry, irritating cough by being on an ACE inhibitor medication. Now that's a cough you can't attribute to having a cold or the flu or for any other reason. If you do get that cough, don't fret, you can get switched to an ARB. Now ARBs don't have that side effect of having a cough. Another thing to expect by being on ACE inhibitor or ARB medication is that we need to have more frequent blood work done on you just to measure and see how your kidneys are functioning and how your potassium levels are. These medications can actually increase your potassium levels. So I know I mentioned that these medications actually protect your kidneys. However, if you're dehydrated, that can actually harm your kidneys. So if you're sick, either where you're vomiting a lot, not getting enough fluids, or having diarrhea, you should be holding your ACE inhibitor or ARB medication for a few days. If your doctor hasn't given you a sick day plan, is what it's called, ask your doctor to give you one. You might be on other medication where you also need to hold if you've been dehydrated for quite some time.
Okay, like this is the one that I've always wanted to ask you about, is the beta blockers. This is the one that had the most effect on me. Can you tell me what they are and what the side effects are?
You would be on a beta blocker in order to reduce the damage done to your heart following a heart attack, reducing the amount of work that your heart has to do. And by being on a beta blocker, you're actually reducing your risk of having another heart attack. Some people might have trouble sleeping, but if you're on a beta blocker that's once a day, you can try moving it from bedtime to morning to see if that will help with your sleeping. Another important thing about beta blockers is that they might give you cold hands and feet. And that's because the slower heart rate will change your circulation. So you might be getting less blood flow to your hands and feet. Not that it'll do damage, just that you might get that side effect. And lastly, and also really important, is that beta blockers might mask the symptoms of having low blood sugar. So beta blockers will make you feel tired and weak. Having low blood sugar will also make you feel tired and weak. As I've mentioned before, with all the other medications, it's also important for your beta blockers not to stop them abruptly at home without speaking to your doctor or your cardiologist beforehand. If you stop your beta blocker medication, you can actually get more chest pain, and it can actually cause another heart attack.
So these guys are my new best friends.
Yes, beta blockers will be with you likely for life, but some patients might not need it for life, but that's something that your cardiologist will determine.
There's a lot to remember. Like, this is really overwhelming. Like, I know it honestly took me about a month before, everything kind of leveled out. And I got familiar with it. It's less intimidating.
Once you get on track and you get a routine going, it will get better. And that's why it's always important to have that personal one-on-one relationship with your pharmacist, so that if there are any changes or if you start anything new, that they can help guide you through the changes as well.
So what are some ideas for you to keep things organized?
Yeah, so there's multiple different regimens you can do at home to remind yourself to take your medications. First of all, some patients really find that keeping a list, a comprehensive list, somewhere visible to be quite useful, so either on your fridge. It's always important to keep a current list on you, either in a wallet or in a purse. You can always ask a loved one to help you either remember to take your medication or to help organize your medications. Some people who are more tech savvy can also use an app. There's many apps that you can use on your smartphone or your tablet at home to either keep your medications on a regular schedule and to remind you to take your medications. You can use something like this, which is a pill box, and it's divided based on like a 1-week divider. And if all of that is still too much and you're still not able to manage your medications at home, you can ask your pharmacist to provide bubble packing for you. And essentially your pharmacist will divide out your medications based on time of day and organize your medication regimen, not only for your heart attack medications, but for any medication you take, even over-the-counter stuff.
I'm not on nitroglycerin, but I know a lot of patients are on nitroglycerin, and I know it's in a lot of movies when the people are saying, "Where's my nitroglycerin?" Can you explain what nitroglycerin?
Nitroglycerin is used to prevent angina chest pains. It opens up the arteries quickly. It improves blood and oxygen supply to the heart. It reduces workload and oxygen needs of the heart, and it also lowers your blood pressure. Always remember to store it in a cool, dry place. It's really important to know how to store this medication because you might not need it for a long time and all of a sudden you need it. You want to make sure that you're storing it properly. So cool, dry place at room temperature. And it's also important to know how to use the medication, and if you have a significant other, that they should know how to use the medication as well in case they need to give it to you. So if you are experiencing chest pains, first thing you need to do is sit down and have your nitroglycerin spray ready. You want to prime the spray by spraying it into the air for at least 1 or 2 times. If you're using a nitroglycerin tablet, you will place 1 tablet under your tongue, or if you're using the spray, to do 1 spray under the tongue. It's important to note for nitroglycerin, do not shake the spray. It's also important to know, do not inhale the spray. It will only work if you spray it underneath your tongue. After your first spray, wait 3 to 5 minutes. If discomfort persists, use a second spray or a tablet. After that, wait 3 or 5 minutes, and if you still have discomfort, use a third spray or tablet and call 911. So if you've been given nitroglycerin spray and you found that you're using it quite often, or you're still continuing to have chest pains despite being on medication, your doctor might prescribe a nitroglycerin patch. And this patch is generally applied once a day in the morning. And what we say is to keep it in the t-shirt area of your body and rotate every day where you apply the patch, just so that you don't get any skin discomfort from the adhesive from the patch. It's best if you leave the patch on for only about 10 to 12 hours a day. If you leave it on for 24 hours, it won't really do much. It's just best to have it for a short amount of time. And the other important thing to know about nitroglycerin is that it can really reduce your blood pressure. So if you reduce your blood pressure right away, you might get a headache, and that's one of the most common side effects of being on nitroglycerin. If you do experience a headache, but you need to be on nitroglycerin, you can take Tylenol for the pain. The other important thing to know about nitroglycerin is if you've recently ingested Cialis, Viagra, or Levitra, taking nitroglycerin during that recent ingestion is actually a bad idea, because both of them will dangerously decrease your blood pressure and it could be fatal.
So when it comes to, like, I take multivitamins, like vitamin B, vitamin C, vitamin D. Does that affect my medication regimen, or?
So that could be a tricky question, because there is an anticoagulant or blood thinner called warfarin that can interact with many herbal supplements, and especially supplements that contain a lot of vitamin K in it. So if you are on something that's a blood thinner or anticoagulant, you can always bring your list to your pharmacist and say, I want to take these supplements. Is it safe to take with the current medications that I'm on? Now, having said that, having a good vitamin routine is also important for your general health. So that could be important, but then again, making sure you get everything checked by your pharmacist is a very good idea.
So when you're looking at, like, some people who are on a holistic diet, it's a good idea for them to bring that information into the pharmacist or their doctor.
Yes, definitely.
When the regimen comes in.
Yes, definitely. Having a list prepared of exactly what you're taking and how much you're taking, even if it's natural health supplements, is important for your pharmacist or your doctor to know, just so that we make sure there's no drug interactions between the two. Or even if you're sick and you have a cold and you want to take something over the counter, some of the drugs that are over the counter can also interact with your medications at home. So again, have that checked by your pharmacist when you go to buy it from the counter.
I felt super tired after taking some of my medications, and I know one of my medications, it made me go to the bathroom a lot, like urinate a lot. Can you help me out with those?
So you were probably on a medication that was a water pill. That's what probably made you urinate a lot, and that usually you would take in the morning if you were on a water pill to prevent you from waking up at night. But you can't prevent the fact that you need to urinate so much after taking a water pill. That's just the drug working.
Any last information or hints, tips before we go?
Yes, definitely. There's a few things that are important to keep in mind for your medication regimen at home. Always carry a list of your current medications on you and know why you're on them. You'll never know when you need it in case of emergency. When you're traveling, make sure you take enough. Establish a routine and use either a pill organizer or get your medication put into bubble packs by your pharmacy. If a dose is missed, do not double up the next time. Do not use herbal products to replace prescription drugs. They will not work the same. Ask your doctor or pharmacist before starting anything new, including over-the-counter medication and herbal supplements. Try to always use the same drugstore. That way, your pharmacist will know you and what you are taking. It is not recommended to take vitamin E after heart attack or hormone replacement therapy after heart attack. Both of these can increase your risk of heart attack once you have heart disease. And finally, maintain a healthy diet, exercise, and if you smoke, please quit.
Oh, you gave us a lot to think about.
It was nice to talk to you.
That was a pleasure. That was Myrna, my pharmacist. She shared a lot of information today, and there's going to be a lot of information thrown at you. But one thing's for sure, be sure to take your medication, be sure to ask all the right questions, and there is no wrong questions. Because when it comes to your personal health, it's up to you.